Hello and happy Friday, everyone. So excited to see you all today. We finally made it to the end of the week. We're hours away from the weekend. Do you guys feel that? Yeah, yeah, good stuff. I'm going to give it a few New Mexico minutes until it's 12 o'clock New Mexican time. We've got phenomenal presenters today, so I'm excited to get into that with them. Uh, In the meantime, as we're waiting for people to trickle in, does anybody have any exciting weekend plans? Everybody's just living boring lives. What's going on here?
Fishing.
I'll share my weekend plans.
Okay.
And I'm just sharing because I'm a mom of two little kids, but they are spending the night at their grandparents' house tonight. So I am
Ooh,
like kid free and I'm literally doing nothing, and that's all I want to do. So I'm
I
excited.
definitely get that vibe. Yes. Yes. Sometimes that's the coolest thing to do. Nothing.
We don't need a fishing pass this weekend, so I'm going to Hopewell Lake with my dad and my daughter.
Good stuff. Good stuff.
There's a live concert in Los Alamos up on the hill tonight,
Ooh,
so come on up. Everybody's welcome. Food trucks. It's just a great time. It starts at 6:30.
ooh, that's
Yeah,
awesome.
they've
That
been
sounds
doing
exciting.
that for a few weekends, haven't they?
Yes, it started. This is the third one. It started Memorial Day weekend.
Oh, that's gonna be so fun. I've a lot of the food trucks there are really good.
Go to
It's a fun
Manco.
time.
He's from Santa Clara Pueblo. He has a food truck
Yes.
called
Oh,
Manco.
Monko, he's so good.
Yes, he's great. I thank you. Have fun, you guys.
Beautiful. And I'm going to give it 60 more seconds as people are trickling in.
Were you guys talking about your weekends? Can I jump in?
Absolutely.
I'm so excited. So, my 23-year-old and 21-year-old are home for the summer, both from college.
Ooh.
23-year-old is 6'3", 300 pounds, and we are going camping this weekend. In our camper, we camped with them when they were much smaller, and it's going to be squishy and wonderful, and I can't wait. And nobody's going to sleep well because all the beds are too small. But we're looking forward to it.
We're gonna have such opposite types of weekends.
Yeah,
Yeah,
exactly. When they're in their 20s, Janelle, it's a pleasure when they're around.
yeah, definitely. All right. Well, we're going to go ahead and get started. I know people are still trickling in. I'll try to stay on top of that as I'm reading. In the meantime, welcome everybody. We've got two phenomenal presenters today presenting the New Mexico Rural Library Initiative. I know many of you were excited about this, so uh, we're excited to jump in with this. Always, we want to give our land acknowledgement. The New Mexico Alliance of Health Councils gives sincere gratitude for the opportunity to live and work here on ancestral and unceded lands that have been cared for by our state's original peoples of the Apache nations, Pueblos, and Navajo Nation. We honor and respect the indigenous cultures, traditions, languages, and rich contributions that continue to shape New Mexico. Together, we acknowledge the history and impact of genocide, dispossession, colonization, and ongoing systemic inequities in indigenous communities. As a collective, we commit ourselves to working towards justice and reconciliation, dismantling inequitable systems, standing in solidarity with, and respecting relationships with indigenous peoples. The Alliance affirms indigenous sovereignty and self-determination and self-governance of New Mexico's tribes, pueblos, and nations. In offering this land acknowledgement, we encourage you all to reflect on your own relationship to the traditional lands and take concrete action to dismantle systems of oppression where indigenous peoples are empowered and celebrated. And today's presenters are Shel Nymark. He is the founder and executive director of the New Mexico Rural Library Initiative. The New Mexico Rural Library Initiative, which seeks and provides resources to more than 60 libraries throughout the state. Also, one of the founders of the Embudo Valley Library in Dixon, New Mexico. Shel has worked with rural libraries for more than 35 years. And we also have with us Aspen Coriz Romero, who is the fellow with the New Mexico Rural Library Initiative. Aspen is working to gather insights on the many roles libraries play in rural and tribal communities. Born and raised in northern New Mexico, Aspen carries deep ties to the area. Thank you and welcome, everybody. Please give them a digital round of applause or physical if you like. And I'm going to go ahead and hand it off to you guys.
Thank
Um,
you, Joseph.
Thank you so much. I will introduce myself first, and then Aspen will be taking the lead on the presentation. I'm Shel Nymark. I'm presently in Grand Lake, Colorado, and using their public library for their Wi-Fi. So libraries are great for travelers too. We we at the New Mexico Rural Library Initiative are developing programming resources for libraries and helping them come up with programming, especially health programming. Healthcare is libraries are wonderful partners for helping small communities connect with healthcare. And if I'll be here for questions, but I'm going to hand it over to Aspen, our NMRLI fellow. Aspen has visited almost all of the 60 plus libraries we work with, has written reports on them and talked to them, of course, about their healthcare needs and what kinds of programming could be helpful for them. So, Aspen, why don't you introduce yourself and start the program? Thank you.
Yeah, thanks, Shell. Like mentioned, my name is Aspen Coriz Romero, and I'm a fellow with the New Mexico Rural Library Initiative. My role has been primarily researching the libraries we work with. We did a statewide survey last year that was compiled into a report for the Legislative Finance Committee, and that could be found on our website. I've also been doing site visits and speaking on the ground with library staff to hear about all the wonderful things that they do for their community and where needs and challenges arise for them. I'm going to be primarily leading the presentation today. And at the end, there's some room for questions, and I'm just really excited to get to talk with you guys about this. So this is about rural libraries and community health. Okay, so the role of libraries is an essential third space. And what do we mean by third space? So individuals go to work, they go to school, they go home, but there's an increasing lack of places where people can gather and interact with one another outside of the spaces of home, work, and school. Libraries are really unique because anyone, regardless of age, income, background, is welcomed in the library. You're not required to spend any money to go to a library, can utilize their services without spending a dime. Libraries are publicly accessible, and in modern society, it's really hard to find publicly accessible community spaces where you don't have to spend any money, where anybody is welcomed. And this is especially true in residents in rural and frontier communities. There's a lack of third spaces, and the library often serves as that third space. So current societal structures compounded by the COVID-19 pandemic have created a crisis that's rarely talked about, a crisis of social isolation. And this figure here on the left that says lacking social connection is as dangerous as smoking up to 15 cigarettes a day. I first heard this figure at the Association for Rural and Small Libraries, went to a conference last year, and that was just a really staggering thing to hear. And this is a report from the former US Surgeon General. And loneliness can increase the risk of premature death by nearly 30%. Those with poor social relationships have greater risks of stroke and heart disease. And isolation elevates a person's likelihood for experiencing anxiety, depression, and dementia. And public libraries are on the front lines of combating social isolation and this crisis that's really talked about, as they often serve as the only places where individuals can find social connection. This is one of the vital roles that our organization has identified rural libraries playing. Additionally, rural libraries play a second role in improving health in their communities. They play a dual role as a social hub, but also as sites for the disbursement of both information and resources. In the world in which we live, there's an overwhelming amount of information. It's really hard to make sense of it all with technology, internet, social media, and now AI. It's really hard to kind of figure out what information is the right and wrong information. So libraries function as a sort of filter, helping patrons distinguish between the right and wrong information. I really like this quote by Linton Weeks, which says, "In the nonstop tsunami of global information, librarians provide us with the floaties and teach us how to swim." So not only are libraries disseminators of health-related information, but they're actually leading initiatives that ensure that their communities have access to essential resources that implement holistic well-being. So this is going to take us into the depth of resources that we've identified New Mexico's rural libraries providing with regard to public health. So I have some photos here. Libraries address basic needs. You see the food pantry on the left there. This is the main food pantry at the Tularosa Public Library. Several libraries that we work with either have on-site food pantries or do food distribution and act as food distribution sites out of their community. They also provide other essentials. On the right, there's this self-help shelf from the Moriarty Community Library that provides menstrual products, toothpaste, floss, other basic needs, diapers. Those are free for people to take with no questions asked. Other basic needs that libraries provide that people don't often think about is access to potable water. Several libraries provide potable water to those in their community that don't have access. They also act as heating and cooling centers for people who don't have AC or heating at home. They can come to the library, or those who are unhoused can come to the library and seek refuge from the elements. Several libraries promote nutrition through community gardens. I have a photo here in the middle of the community garden at Anton Chico Library. Several libraries also have native seed libraries to promote local gardening, and some libraries also offer cooking classes. Exercise and movement classes, I'll get more into that as we progress through the slides, but this is another thing that a lot of libraries offer to their community members. They also provide workshops covering healthcare, disease prevention, and legal issues related to death and dying. Libraries also provide access to telehealth spaces, which is really crucial for rural communities. I have a photo here of the telehealth booth in Fort Sumner Library. People in Fort Sumner have to drive over 150 miles to either Albuquerque or Lubbock, over 3 hours away, to seek specialized care or to go to a hospital just because they don't have that near them in Fort Sumner. So telehealth has helped fill that gap. And then finally, a lot of libraries are also supporting mental and emotional health in their communities. The library in Lordsburg, I was speaking with their director, and she shared this adult mental health care support group that the library hosts, where they get together, they journal, they share coping mechanisms, and just have a safe space to confide in other adults who might struggle with their mental health. Okay. I think something happened that this slide got mixed, but this is back to the social connection thing. I'm going to kind of skip over it. I think this slide was actually supposed to be before, but this is how common is lack of social connection. About 1 in 3 adults in the United States feels lonely, and about 1 in 4 lack social and emotional support. Okay. So this is the Osako Community Center and Library, and this is actually the community that I grew up in. And they're a stellar example of libraries and community health initiatives. They have weekly exercise classes with an emphasis on balance and fall prevention for older folks. They hosted a CPR and first aid class for youth in the community. It acts as a food distribution site twice a month, and they offer food to over 50 families in their community. And then they also have Detour Cafes, which is this photo on the top left, where once a month they host coffee and people just come and chat and gather with their neighbors. And many libraries host similar gatherings, whether it's sharing coffee, fiber arts group, a colchetta group, a craft afternoon, things like that, just spaces where people can come and connect. Okay, and then circling back to Fort Sumner Public Library, they're another leading library when it comes to community health initiatives. They have a Sacred Steps movement class, which incorporates dance and movement, and this one is for ages 12 and up. They do this every week. Their annex in the library is a host site for blood drives, flu shot clinics, and for a while their WIC office got flooded, so staff were meeting with clientele at the library in the annex during the time that the WIC office needed to be renovated. They also hosted a diaper drive in collaboration with the United Way of Eastern New Mexico and Vaca County to get a bunch of diapers for families in need in the community. Many libraries, such as Pueblo Poake Library and the Thurgis Library, host presentations on Medicare that ensure residents are aware of changes in their coverage and fully understand their benefits. These are really useful because healthcare system's super convoluted. So having this kind of in-person sessions are really useful for people to understand their health insurance. Many of the libraries we work with host presentations by End of Life Options New Mexico, ensuring that elderly patrons are knowledgeable about advanced healthcare directives and are empowered to make the choices that are best for them and their families. Many libraries do this. We also have a flyer from Carizozo Library that also hosted a presentation by them. I would also like to add that the Baldwin Cabin Library in Daddle, not only do they host these kinds of information sessions, they also host an Alzheimer's support group out of the library, which offers support for caregivers of those with Alzheimer's. And then this is Bayard Public Library. And when I went to go visit with them, their director said something really stuck with me. She said, I see libraries as community connectors. And that is so true because through collaboration, community libraries connect their community with what they need. In the case of Bayard, they hosted an info session on Alzheimer's prevention. They've also worked with the New Mexico Aging Services Department to host presentations covering estate planning and power of attorney, which are really crucial and things that people don't often think about. They also are huge into promoting healthy environment. This library does a lot of eco-related programming. They have a community garden that's really beautiful. They've done classes on soil amendment. They did a group trail cleanup. They did seed bombs. And then they also taught kids about composting and worms. So what is the role of our organization in all of this? Like Shell mentioned, we're an advocacy organization. We advocate for state funding to support rural libraries. We also help connect libraries with resources, health-related ones, other related ones, but in this conversation, health is kind of relevant. So we've made connections with Villages of Santa Fe, which is a nonprofit organization that hosts mobility movement classes, and we've been able to connect them with rural libraries. And as you can see here on the left, the Embula Valley Library is hosting a session this weekend with Villages of Santa Fe to talk about fall prevention. We also have connected libraries with End of Life Options New Mexico. That way they can provide health-related programs and services to their communities. And then this is some more sources. I'm happy to send these slides out if you'd like to kind of read more. And then this is a bit about where I got information on social isolation crisis. And here is our contact information as well as our website. And I'm open to any questions that you might have, any discussion. And I hope that this connection can lead to further collaboration with libraries, as they are really great partners for collaborative resourcing.
Thank you so much for that presentation. Please give more digital rounds of applause. Are there any questions? I don't see any in the chat.
I see someone raising their hand.
Go for it.
Hi, this is Tana. Were you talking about me?
Yes.
Okay, great. That it's so inspiring, Aspen. Thank you so much for that. We met with Shell last week and heard all about you. And um, if an organization were to want to write a
Uh-oh, I think we lost you.
Yeah, I was like, I think she froze.
We'll keep an eye on the chat or when she comes back, and we'll try to get that question to you.
I'm gonna stop sharing my screen just so we can see everybody, but I'm gonna drop the link to these slides in the chat.
Oh, there she is she there? Or because I see her, but I don't know if she can speak.
Yeah, I'm not sure what's happening there.
She's
Right.
frozen.
Probably. Well, I just wanted to make a comment. This is Gina Posada here at Health and Human Services in Doña Ana. We have a library in the Dolores Wright, which is not open to the public as to check out books, but we have computers. And so people come and use the computers, do research. I had a person come in and take one of his legal appointments there. We helped him out with how to access because, like you mentioned before, he was in Doña Ana and he had to travel to Alamogordo. His vehicle wasn't working. And so, we were able to have that appointment virtual. And he had an interpreter. So since then, he goes over and he looks for us, and we assist him in getting that going. So yes, I think that's very useful. I love libraries and books, and so I don't know who right now is working on that. So I would like to provide your information to them, and maybe a collaboration could be done in the future.
And we also had one in the chat. It says, our health council has attempted to partner with our local library to make naloxone available to the public on an on-demand basis, but we are told that city government didn't approve of the initiative. How do you recommend we move forward? Thanks.
Um, that's a really hard question. I think there are a lot of libraries in villages where the village doesn't really understand what the library does, and it can be a problem. As us as an organization, we haven't really jumped in to approach village councils. We work with the legislature and do stuff on the state level, but that's something that we haven't done. I would suggest maybe speaking with the library director there and asking them how you would approach the village council again with evidence that having naloxone in libraries can save lives. We have it in the Embudo Valley Library, I know.
Mhm.
Aspen, do you have anything to add to that?
I don't. It's a tough situation because many of the libraries we work with, a little less than half of them are municipal libraries, which means that they're kind of under the governance of their local municipality, and the people in leadership can kind of dictate what goes on in the library, even though some libraries might be interested in offering those things. At the end of the day, they don't really have the overall power. It's a tough situation.
I also noticed that we got our sister from Rio Arriba back on the call. Would you like to finish your question?
Thank you so much, Joseph. Our internet went out here for a moment, so three of us were kicked off. So it gave me time to formulate my question in a more elegant way. My question is to the Rural Library Initiative. What support could you use from organizations in your community to help bolster this programming that you're trying to do? Something that came up in conversations last week with Shell was around possibly community health worker time, that other organizations have community health workers that are trained to help with patient navigation, to help with the technology of things like telehealth pods. Like I know at the Dixon Library, I think you have 1.5 FTE to do everything, and now and now expected to help with telehealth also. So first, what support could local organizations give you to help make this as successful as possible? And then if an organization were to write a grant to help support this project, who would we go to? Would it be like if we wanted to do that in Ray County, would that be Shell, or would that be through the UNM Health Sciences Center library? Like, I'm not clear who we would go to for collaboration.
So I think the first thing that would be good to help collaborate with us is to have a program in mind, have a presenter in mind, let us know what libraries you're willing to go to with what kind of programming so that we can put that on our list and present it to the library. Say if it's in Rio Arriba County, we could let all the libraries in Rio Arriba County know that there is a presentation available, and then we would probably put them together with you rather than be the middle person organizing it. Yeah, that's where I would start. Anybody in the state that has programming ideas, that would be fantastic. Let's see, what is there something else you wanted me to address too, as far as
It was about the shared community health worker time to help with things like telehealth pods.
right? So, are you referring to the Heroes program mostly, or just or that's the model for the community health worker? Um,
Uh, Not necessarily. So it could be, let's say that El Centro Family Health, for example, is a nonprofit, has have patients in the rural area that could take advantage of the telehealth pod to meet with their provider. Having maybe El Centro has community health workers who are currently spending time in Espanola, but could spend some time at a rural library helping patients complete that telehealth visit. Does
yeah,
that make
there
sense?
right now in
Yeah.
Rio Arriba, I'm not sure. Aspen, are there any libraries in Rio Arriba with a telehealth booth yet?
Not the booth. So the booth that we showed in the presentation is a specific program that was facilitated by the New Mexico State Library and UNM Health Sciences Center, that distributed those specific booths. I will say that the trauma library had created their own telehealth office. They had like a little space. They put a desk and a computer in there. So they don't necessarily have like a booth, but they do have a telehealth meeting space available for people in that community.
So, so the state library has a telehealth booth program, and so far they've only given out six, I believe. And then there was some kind of holdup, and the next batch should be going out more soon. But NMRLI, is not really working on getting libraries telehealth booths because that's something the state library is doing, and we don't really need to duplicate their services. But as far as having a healthcare advocate come to a library, most of these libraries will have a kind of a quiet place where people could meet. Um, and I think, again, if that's some resource that you have, we can connect that kind of resource with the library. Say somebody from El Centro wanted to come to library every couple weeks or something like that. We're glad to connect them with libraries in the communities they serve and see if the library is open and would advertise them coming and, kind of work it out. But again, that would be something once we did the connecting, that would be something for the library and the advocate to kind of work together on.
Great. Thank you.
Yeah. And then just to kind of add on to your question, I think what Chell is saying, yes. And then like maybe having some kind of like designated time that a community health worker would come, like having that kind of consistency is really good. Like if they came like on the third Friday of the month or whatever, be whatever works best for a library. It's always best to kind of coordinate with them to see what works best for their programming slate. And then you also asked a question about grants that I didn't want to like ignore or get lost. If you wanted to do a collaborative grant with libraries, I think that they're very interested in, whatever funding they can get. A lot of libraries are always open to new types of programming. I think communicating directly with libraries that you're interested in possibly doing a program with, and talking about, applying for grants and stuff. I think that's kind of the best way to go about it is just direct communication with the staff at the libraries that you're interested in collaborating with.
Great, Aspen. Thank you.
Yeah.
Yeah, I could I also respond to the person from Doña Ana County who was talking about the small library that doesn't necessarily give books right now. If anybody has a community that wants to start a library, we help advise them. We on our website under resources, we have a handbook on how to start a library in a small village. So if they are interested in becoming a public library, have them reach out to us, have their director reach out to us, and we're glad to advise them. Once a library becomes what's called a developing library by the New Mexico State Library, they're eligible for funding from the library endowment, which this year will be about $27,000, and they're eligible for some other funding streams too. So yeah,
Thank
have
you.
them reach out to us.
Yeah. Is
I
this
will
the
do that.
library in Chaparral? I'm just curious.
Right. Yes.
Yes.
So
Okay.
it's not functioning right now because they're cataloging all the books. But we have computers that people or the public can access, and they can either we can help them out, or most of them know how to maneuver a computer, or the
Yeah.
people that I've seen. But
Yeah,
yes,
yeah. We have been in touch with one of the people there who has been leading the charge. I believe her name's Isa.
okay,
Yeah,
wonderful. Okay,
yeah. I
great.
know that they've been having some issues with just like the municipality and all of that. And that again just goes back to sometimes things are just out of the power of those in the library. But that's just helpful for clarifying. Thank you.
You're welcome. Thank you.
We also had another question in the chat. This is from Ariana. She says, "Hello, I'm with the New Mexico Department of Health Heart Disease and Stroke Prevention Program. I'm starting a supportive partnership to expand the American Heart Association's Libraries with a Heart, or excuse me, Libraries with Heart program, and I'm seeking libraries that would like to participate, especially in southern counties like Chavez and Luna. It's a self-measuring blood pressure monitoring program to support community members track their blood pressure and spread awareness of cardiovascular disease. Would love to connect, and she has her email there. So that's for everybody to know. And also really quick, I just wanted to make aware, if you didn't catch that, Aspen dropped the slide presentation in the chat, so you can click that link. And also, Lisa, thank you, gave us the link for the Los Alamos Summer Concert Series, which looks really fun. And I'm wishing I lived closer to there.
So Ariana, thank you for that. If you could email us the information, we will get it out to the libraries in the southern part of the state that we work with. So we work with about 60 libraries. All but two are in villages or pueblos that have fewer than 3,000 people in them. So that is that is the base that we work with. Most of these libraries are severely underfunded, so we look for funding for them through the state legislature and other places too.
Yeah, I'll just add, thank you, Ariana, for sending that information. We would be glad to send that out. And then in terms of Chavez, I don't think we have a library in that county that we work with, but we do work with Columbus Library, which is in Luna County. And we'd be happy to connect you with the director there.
Hi. Hello. Yeah, that sounds great. Thank you. Could you guys put in your email in the comment section? I keep trying to click the link, but I guess like my computer blocked the site, so I can't really get the slides.
Yes, I will drop both Shell and I's emails in the chat for you guys.
Okay, thank you.
Thanks.
I see your hand, Lisa. Go for it.
I just had a question and a comment. My question is, we'd love to hear how many other libraries throughout the state are doing youth programs. And then my comment is, our head librarian, Gwen Calavasa, is online, and I'd love for her to tell you about some of the youth programs that we do: community health, youth summit, mental health awareness. We do a thing called Atomicon, which is like Comic-Con because we have a lot of science nerds up here, and all kinds of activities for the kids, and they love it. We're very blessed because we do get county funding for our library. But I was just curious if anybody else had any programs that they do, and then I'd love for Gwen to, if she's comfortable, to tell you guys about it.
Really love to. Aspen, do you want to address that?
Yeah, I could. Do you mean youth-related programming in general or health-related programming for youth?
Oh, well, kind of both, because I think any program that we have affects the mental health of kids in a positive way. But yeah,
Yeah, absolutely. So, a majority of the libraries host summer reading programs. There are very few that don't do summer reading programs, so that's an annual thing all libraries do. Um, and it varies, in terms of how many sessions they're doing a week, the age groups and that kind of thing, but that's a pretty consistent thing across the board. We have many libraries that do after school programming, a lot of story time also for littler ones, so pre-K kids, infants and their families. In terms of youth programming in that regard, there are a few libraries that I've spoken with that do incorporate health related stuff into their programming. For example, the Moriarty Community Library, which I talked about in my presentation, they collaborate with their local NMSU Extension Office, like the ICANN program, to do nutrition information and integrate that into their summer reading program. And they also collaborate with 4-H, their local 4-H chapter, to bring healthy snacks to their summer reading program as well. The library in Cochiti Pueblo collaborates with their local health department to do Kid Fit. So they do like physical fitness, information about nutrition. So they definitely are trying to integrate some of that health related stuff into their summer reading and other educational youth programs. Does that answer your question?
Yeah, what I'd like to add, and yeah, we'd love to hear from Gwen, but we we are that is something that we and MRLI is working on right now. Actually, our two focuses of resources to get to libraries is healthcare resources and K-12 out of school time programming. We have a grant right now to help libraries boost their capacity to offer K-12 programming. Most libraries have some. We'd like to see funding for a greater majority of libraries to be able to offer that.
excellent. And I saw in the chat people were trying to get Narcan. That is one of the things that our library does, is we have supplies of Narcan at the libraries and other locations. So we try to advertise that as well. I don't know, Gwen, I'm going to put you on the spot here. Are you comfortable telling them a little bit about our youth summits?
Absolutely. I am happy to talk about the library.
She's sweet, love Gwen.
So I would just say kind of in general overall with all of the things that we do at the library, one of our main goals is to create that community and create that connection, both with members of our community, but also so that our community members can connect with each other too and find those bonds and those relationships that would be meaningful for them. And so in terms of our children's programming, we do that like most libraries do with story times and that sort of thing. One of the things that we do for the summer, which has turned into a really lovely opportunity, is we call it our creative studio, and it's one day a week, and it's a 3-hour craft session, basically, where members of the public can come in and just do whatever crafts they choose. It's sometimes guided, and sometimes we have guest artists in as well who are, working with kids to show them a particular technique. But it's just turned into a really lovely experience during the summer for people to form those connections. And so Lisa also mentioned our summits, and we've actually done this for youth and been a part of summits for the for other populations as well. But the library hosted a youth summit last spring. I guess it was in March or April, and so it was really we really were just the host, and the local organizations brought in various speakers to entice teens, and I think we had a really great turnout of, I think, over 100 teens come and participate in that particular summit. It was really quite nice. I'm sure there are many more details about it that Lisa could share, but yeah, it was really wonderful, just for the library to be a place where teens wanted to come. They chose to have it at the library, so that was telling. So.
And we do also have our social services department, I believe, Wednesday evenings. At both libraries, just available to clients. And we do have a social services office where they can help with, connecting them with services and such. But they're also available at the library and the farmers market here in town. So. Thank you.
Chris, you had a question? Go for it.
Hey, this is really interesting. I've heard some other presentations by other library systems, and I have to say that I'm a big advocate of libraries, being that I'm probably in a library every Saturday getting new books. But I quite often try to make connections between things that are happening in the state. So I'm curious whether your whole program knows anything about, or if you have been approached by anyone from, let's say, the healthcare organization or an organization called Find Help about the Yes New Mexico Connect program in the state. And I would ask that question first, and then just mention that the Yes New Mexico Connect is an effort by the healthcare authority here in the state to start a platform, if you will, a system basically for, let's say, patients who come in for health issues, or people who are, just as you had mentioned before, Lisa, social services. Some people may need things like food, they may need transportation, those other kinds of things. But the idea to sort of better connect anybody who may have both a health problem and, a need for non-medical help that still contributes to their health. And so they're developing a statewide sort of referral system for doing this, and sort of finding out, what are the results from this at the same time. And it does seem to me that the libraries, especially since the system at the moment is really only operating on a self-referral basis just now, that you may have in the libraries, especially in the rural areas, people coming in that may ask you about social services or other places where they can get these. And yet you have the computers to be able to do that. So I'm curious, it seems to me the libraries would be a key sort of element in this kind of process in the state. So I'm wondering, one, if you have any knowledge of it, or if, healthcare authority has approached you at all about it, and or, if you would be interested in doing that, in which case we could share information.
I have not heard of that organization. Have you, Aspen?
No, I have not heard of this initiative, and we have not been approached by anyone from the healthcare authority regarding it.
So, but it sounds like something that we should research.
And I can, since you've put in your email, I can send you information about like who to contact on that. But it does strike me, especially in your rural outreach area, that you would be a great resource, in a sense, to be part of this whole system.
Yeah, it
Please share
sounds
that
really
information.
interesting.
Thank you.
And next we have a question from Monica.
Hi, all. Ms. Hollis, I have heard of that. They did a presentation when they were right before they pushed it out. And so when you apply for Medicaid on Yes New Mexico, it's a link on there where you can access to different types of services. It's not much different except for the fact that you can like refer people real time on there, which I don't think that libraries are going to do that because I've talked to a few people and I don't think they're going to take the time to do that even in the rural areas because they're so shorthanded. They might, but the Share New Mexico is more up to date, and the 100% that are going around, they're more, and the 211 are more up to date as far as referrals than anybody else. So when it comes to referrals, that's who I always recommend. I do outreach in southeastern New Mexico, and I work over the whole New Mexico. I'm with the Department of Health, and I'm a health educator. Also, the other thing is, I know Sarah had a question in there earlier about the Carlsbad Library. We recently did an event there with Sarah, and we did testing and Narcan, and they let us park there. They were really accommodating, and we're going to do more events there. But the one person was looking for a house or a place to a home to go stay at, some kind of shelter. And she went inside and she came back out and said, the librarian helped me find a place. She made a call and I'm heading over there now and they'll let me keep my dog. So that happened while we were there, and I was like, oh my gosh, that's just amazing. But my other thing is, have you heard of the kiosk where they give free Narcan? It's kind of like a candy machine, right? Um, I'm surprised we don't have them at our libraries because a lot of libraries allow the unhoused population to charge their phones, or people that don't have access to internet. That's where they go to do all their online stuff. But I was thinking that would be a really good place to have a kiosk, is at all the libraries in New Mexico, basically, because every town that I work in, Clovis, everywhere, there are always libraries is where I find my unhoused population a lot. Anyway, I just wanted to share that. Thank you.
Go for it, Sarah.
One quick, if I could, Jeffrey, I'm sorry, just one quick reply to Monica. Monica, I agree with you in terms of where that system is right now. 211 is part of that Yes New Mexico Connect, but I think it would do the libraries good to understand what's happening because statewide, this system will take place at some point.
And we had Sarah, and after that, Pamela.
Yes, thank you. Hi, everybody, Sarah Bowman. So to respond, Monica, I was trying not to call out Carlsbad Library specifically because they are working so well with us when it comes to doing those pop-up events. What we're having issues with is trying to get those sort of vending machines available in the libraries in Carlsbad and Artesia. That's why I asked that specific question. I agree, it would be a great idea, but as it stands, our local government is very against it. And so that's why I was trying to get some brainstorming on how we go about getting around that and hopefully not ruining that great relationship that we do have with the library director. So just wanted to clarify that point.
Okay, Sarah, sorry if I overstepped. Thank you.
No worries. Thank you.
And Pamela?
Yes, hi, Pamela Skinner here, Community Wellness Council, Valencia County. I am also in the process of putting Narcan distribution boxes throughout Valencia County. And we will eventually go in front of the libraries since I did presentations to both the county and the village of Las Lunas. So they're coming, and our distribution boxes are the newspaper type where they don't have to be plugged in. They're not a vending machine, and you don't have to enter any information. So they're coming. It's just going to take us a little while to get there. Thank you.
All right, we've got about 10 more minutes. Are there any other questions? Great conversation today. I'll give it a few more seconds. Speak now or forever hold your peace. All right.
Well,
Well,
I would say thank you so much for inviting us to make this presentation. I think it sounds like we can do some collaborations, and it was really great virtually meeting you all and hearing what you had to say. I'll add that I hope when the legislature comes up that you guys will support the Rural Library Endowment in the legislature. Some of these libraries, like Carisoso, without the endowment money, their budget is $20,000, $25,000 a year, and they're doing great work. And it's like that with libraries all over the state. So I hope if you have an opportunity to be supportive in that way, that would be great. So I just wanted to give that little pitch and thank you so much again for inviting us.
Yeah, thank you so
thank
much for
you.
this conversation, and thank you, Joseph, for moderating.
Yes, thank you. And thank you for sharing the amazing work that's taking place across the state, the great work that you guys are doing to bring it all together. And I loved hearing all of the great work that health councils are doing across the state with their libraries. I love that we're working hard to increase third spaces as that is necessary in so many ways. And so we want to thank you again on behalf of the Alliance as well as everyone here for coming today and sharing this information and the good work that you all are doing. And as always, the Alliance is here to support you. Please reach out to us if you need anything. And my gift to you today is 8 minutes. How does that sound, everyone? All right, you guys have a great weekend and looking forward to seeing you all whenever I see you again.
Thank you, Joseph. Goodbye, everybody.
Bye.
Thank you.